Guys, enuresis, according to you, what is enuresis? Anyone?
बेड वेटिंग मतलब आप जब सो जाते हो, मतलब आप कॉन्शियस नहीं होते हो और आपको यूरिन पास हो जाता है ड्यू टू स्फिंक्टर एनोमली और मे बी समथिंग.
Yes, very true. So, urine incontinence, that is called as enuresis, is a loss of bladder control. तो कैसे पेशेंट को हमें ट्रीट करना है? एन्यूरेसिस के अंदर, if parents came to you with the age at the age of 3 years child, are you going to treat that child? So what is the age criteria to treat enuresis? Any guess? कौन सी एज के बाद you can treat enuresis patient? Yes, Sakina, 5 years, okay. यूरिन कंट्रोल कब शुरू होता है? Anyone knows?
At 2.5 years of age.
Yes, that is at the age of 3 years. Okay. So when parents came to you at the age of 3.5, in that case, are you going to treat that child or not? Anyone? Are you going to treat or not? The simple question, huh? Yeah, na?
If it is, if there is no control over the urine, you can, but I think stool control is roughly obtained at around 3 to 3.5 years of age.
Okay.
So that need not be treated.
Okay. तो कब treat करना चाहिए? At the age before 5 years of age, generally in our practice, what we are doing, कि जब भी 3 या 5 से बीच में जब भी पेरेंट्स लेके आते हैं बच्चों को, तो वी जस्ट लेट देम नो कि 3 ईयर के आसपास एट द एज ऑफ 3 इयर्स बच्चों में यूरिन कंट्रोल आता है, लेकिन इन सम चिल्ड्रन, इन सम किड्स, इट टेक्स टाइम टू कंट्रोल अप टू द एज ऑफ 5 और इवन 7. तो एट द एज ऑफ 5 तक वी आर नॉट ट्रीटिंग सच बच्चास, वो बच्चे हम ट्रीट नहीं करते हैं, and we just let them know if it is persisting, continuously occurring since age of 5, then we will go for treatment. तो 5 साल तक we are not going to treat such बच्चास in our practice. जैसे ही बच्चा बड़ा होता है, he become more able to control their bladder. The waiting is called as enuresis when it happens in children who is old enough to control their bladder. मतलब 3 साल के बाद, even at the age of 5 years, when बच्चा is not able to control the bladder power, then it is considered as enuresis. It can be happen at the daytime, it can be happen at the night time. अभी रात को जो यूरिन हो जाता है उसको क्या बोलते हैं और मॉर्निंग में जो यूरिन हो जाता है उसको क्या बोलते हैं? You know the terminology? We called it as a nocturnal enuresis. That means जब भी रात को यूरिन हो जाता है, that is called as nocturnal enuresis. Now what about day? दिन के टाइम में जो यूरिन हो जाता है, that is called as, yes Sakina, that is
Diurnal.
yes, that is diurnal enuresis, which is not frequently used term, but as we are discussing enuresis, we must know that is called as diurnal. दिन में यूरिन हो जाता है. This condition is very frustrating condition for parents, even for kids. It is important to be patient and remember that it is not your child fault. So जब भी आपके पास ऐसे पेशेंट आते हैं, एक्सप्लेन देम कि भाई ये बच्चे की तकलीफ नहीं है, बच्चे की वजह से नहीं है, तो नेवर स्कॉल्ड योर चाइल्ड, स्पेशली फॉर एन्यूरेसिस। एन्यूरेसिस के लिए बच्चे पे चिल्लाना या फिर बच्चे को धमकाना इज नॉट अ सॉल्यूशन, बल्कि दैट कैन बी वर्क्स एज अ फियर, तो उसकी वजह से ये तकलीफ बढ़ भी सकती है। सो एक्सप्लेन द पेरेंट्स कि जब भी बच्चा एन्यूरेसिस हो जाता है दैट इज नॉट अंडर द कंट्रोल ऑफ किड, तो एक्सप्लेन बच्चे को इन सम केसेस यू हैव टू अप्रिशिएट व्हेन ही इज नॉट पासिंग द यूरिन। फॉर एग्जाम्पल, बच्चा हफ्ते में 4 बार यूरिन कर रहा है और इन दिस वीक ही जस्ट पास इट फॉर 3 days, अप्रिशिएट द चाइल्ड कि इस वीक में आपने 3 बार ही किया है कंपेयर टू प्रीवियस वीक। So that appreciation helps the child in cases of enuresis. There are 2 types of enuresis. Anyone know the types of enuresis?
Primary and secondary.
Yes, primary enuresis and secondary enuresis. What does it mean? Primary enuresis and secondary enuresis?
Primary enuresis is usually without any cause, that is, it is idiopathic. And secondary enuresis is because of some pathological condition that the bladder has lost control, any neurological deficit or something like that.
No, not like that. Primary enuresis is that बच्चे ने लाइफ में कभी भी कंट्रोल ना किया, and since birth he is suffering from enuresis. For example, 3 साल तक बच्चे को यूरिन हो रहा है, 1 साल तक बच्चा ने यूरिन कंट्रोल किया, and then after again he is passing the urine, that is called as secondary enuresis. लेकिन when patient came to you since at the age of 5 years or 7 years और बच्चे को यूरिन कंट्रोल हुआ ही नहीं है, बच्चा ने यूरिन ट्रेनिंग फेज आया ही नहीं है, if that condition is that is called as primary enuresis. Are you getting my point? Not fully trained for toilet training and still suffering from enuresis, that is called as primary enuresis. And secondary enuresis, बच्चे ने वो कंट्रोल कर लिया है and then again start that enuresis, that is called as secondary enuresis. Are you getting my point, guys?
Yes, sir.
Yes. Now, what are the causes behind bedwetting? Guys, this is now your turn. What are the causes behind bedwetting? Anyone? Any causes according to you? Enuresis क्यों होता है? Primary or secondary, whatever it may be the cause. What are the common causes? Yes, Sakina, worm infection. It is the rarest cause which is not mentioned in your any Google way. Lekin the one of the main cause is worm infection. Yes. Any other cause? Yes, fear. Fear and all psychological causes are more prominent in secondary nocturnal enuresis. That is always there in primary enuresis, but in secondary enuresis, psychological cause is more prominent. Yes, pincher control is one of the cause. Central nervous system, CNS, is defective. Yes, Imanshi, UTI is one of the cause, one of the most common cause, especially in female kid. Any other causes for nocturnal enuresis or diurnal enuresis?
Constipation.
Constipation, ये कौन बोला?
Dr. Hani sir.
Okay, it is one of the cause. When child having constipation, when he strains to pass the stool, that strain causes pressure on bladder, and due to that, bladder loses the control. So constipation is one of the cause. It is the rare one, but yes, it is one of the cause. Any other causes UTI, worm infection, sphincter control, fear, psychological cause. Yes, Shruti, diabetes. कई बार from the nocturnal enuresis, from the diurnal enuresis, we just diagnose diabetes in pediatric patient. When child is not able to control the urine and frequency of urine increases at night, always think of diabetes in pediatric as well as adult patient. In pediatric, when there is not gaining weight, diabetes might be the cause, along with nocturnal enuresis. Yes, delayed milestone, Himanshi, you are absolutely right. Delayed milestone is one of the cause. Although it is not a completely understood why bedwetting occurs. It is thought to happen because of delayed development in at least one of the following three causes. One is bladder. I'm talking about local cause, that is bladder. Another thing, that is kidney, and the central nervous cause is brain. So in sometimes deformity is there, bladder is very short or bladder is hyperactive. In those cases, that nocturnal enuresis can be happen. Sometimes due to kidney, urine is made excessively at night. That is the normal phenomena of the kidney in some patients. That might be the cause. And in some children, in some babies, a brain is the cause in which they are not able to wake up during the sleep. मेरा बच्चा बहुत लेजी है, पूरा दिन खेलता है, लेकिन रात को इतना सोता है, इतना डीप स्लीप में होता है, he is not able to wake up. These are the cause. So how to explain those patients? That is more important. In babies and toddlers, links between the brain and bladder is not fully developed. Parents को समझाओ कि रात को जब बच्चा सो जाता है और सोते वक्त जो ब्लेडर के ऊपर का कंट्रोल होता है from the brain, which is not yet fully developed, and that might be the cause कि जिसकी वजह से child is suffering from enuresis. The kidney, the bladder, you are not going to report, you are not going to search for the cause, but you have to explain the parents. This might be the explanation कि आपके बच्चे का जो एज के साथ यूरिन के ऊपर का कंट्रोल होता है, which is developed in brain during the sleep, which is not fully developed. That might be the cause कि जिसकी वजह से बच्चे को nocturnal enuresis हो रहा है. This allows child to control when the bladder empties. This control usually develops during the daytime first. That is normal phenomenon. More time before it happens at night. Compared to night, ये generally day में develop होता है और रात को बाद में develop होता है. So in causes, genetic cause is one of the cause. If child is suffering from bedwetting after the age of 5 years, child may have suffering from some genetic cause. Genetic cause के अंदर we must ask the parents about the same complaint in their child. If parents are suffering from the bedwetting in their childhood, that might be the cause of children. Parents में child भी हो सकते, मतलब पापा भी हो सकते हैं, mother भी हो सकते हैं. Anyone from both of them were suffering from the nocturnal enuresis in their childhood, that might be the cause कि जिसकी वजह से बच्चा is also suffering from nocturnal enuresis. 70% बच्चों के अंदर जनरली दिस माइट बी द कॉज. बच्चों के अंदर ये कॉज होता है. ट्राई टू फाइंड आउट दिस कॉज व्हेन पेशेंट केम टू यू. One more common cause, that is deep sleep. Deep sleep pattern can be the part of normal adolescence development. When bacha is going to enter into adolescence phase or in teenage, in those cases, deep sleep is very common. Another thing, that is poor sleep schedule or too few hours sleep. Bacha is very much active, constant. He is going to school, and then after on activity, then after tuition, bacha is very much active in the daytime. And due to that, bacha is not able to wake up at night when he gets urge. This is the common during the puberty age, especially in the teenage at the school time. Now, our favorite as a homeopath, the psychological cause. When bacha came to you with nocturnal enuresis, always try to find out the psychological cause. Stress is one of the main triggering factor in nocturnal enuresis. That is most commonly seen in secondary enuresis. Children experience stress when moving to one home to another home. If parents are working in that place, that they have to change the house, that might be the cause of stress in children. Even changing the school is one of the triggering factor for the stress of children. These are the very small things, guys. But when you find out, your medicine will work excellently. When parents are changing the home, when child is changing the school, and child is not able to adjust in new surrounding easily, the homeopathic remedy is Kali Phos. Simply think of Kali Phos in those cases, it helps a lot. Kali Phos you can give in 1 potency, or in some cases you can think of Kali Phos in biochemic potencies, in 6x potency. If you don't get any specific cause in some particular case, prescribe Kali Phos 6x 236x TDS. It works, guys. If you get such mental stress, changing the school, changing the home or house, you can think of in 1 potency. Experiences of parental divorce, or parents are not living together, they are separated, child is living with only one parent. I am a single parent mother. In those cases, you can think of Natramure. Parents are not loving me. Parents are not giving time to me. Child is seeking a love from parents. Nowadays, both the parents are working, child is living with some nanny's house, or child is staying at boarding day. In those cases, nocturnal enuresis can be happen. That is the psychosomatic cause. And in psychosomatic cause, we all know homeopathic works excellently. If we know the cause, try to arrange some situation that child can prevent it. If the cause is divorce of the parents, explain them that might be the cause. So you have to arrange such condition कि बच्चा get love from you. Try to maintain the maintaining cause, to avoid the maintaining cause. If someone is getting coughing from the cigarette, if it is maintaining cause of the coughing, then we have to avoid that maintaining cause. If child is going through major life events, for example, child is going to some school or some presentation in the school, or some, especially in female kid, someone is harassing them in school, some peon in the school is harassing the child. Guys, these are the common causes. Believe me, nowadays they are transporting to the school with the van, from the winger, from the school bus. The school bus driver is harassing him or her. That might be the cause of creating nocturnal enuresis. Try to find out. That stress can cause bedwetting. Even bully in the school. Some group of students are bullying that child in the school. Some group of children are harassing them in the school. That might be the cause. Insulting in the school, guys, is one of the cause. What are the remedy? Ailments after insulting.
Staph is one of them.
Yes. Staphysagria is one of the remedy, and another remedy is stramonium. After insulting, if fear is the cause, we have remedy, that is stramonium. If child is suffering from fear, child is not able to go in another room which is dark. Child, if parents are living in duplex, child is not going to upstairs due to darkness. Fear of darkness is the cause. Think of stramonium. Ailment after stramonium. School में school में teachers call the child, and then after enuresis begins. That is the secondary enuresis. You can think of staphysagria. Try to find out the cause, especially in nocturnal enuresis. Even sleep apnea, snoring is one of the cause. That is the very rare cause. But bedwetting happens because a child has obstructive sleep apnea. Guys, wait a minute. I just got a call from the patient. Repeated call. Wait a minute. इमोशंस कट हो जाते हैं बोलने के। यस, ऑब्स्ट्रक्टिव cause, obstructive sleep apnea or snoring might be the cause, which is very rare cause, लेकिन that might be the cause. तो ask about that. आपके बच्चे का nasal blockage वगैरह रहता है, snoring रहता है. If child is sleeping constantly while talking in class, you can think of sleep apnea, especially in obese kids. Nowadays, obesity is one of the big issue in pediatric cases. So when the child is very obese, the obstructive sleep apnea might be the cause. Partly blocked nasal way, that might be the cause. So nasal polyp might be the cause. So we have to treat nasal polyp if child is suffering from suffering from nocturnal enuresis. That can change the chemical balance in the brain, and that might be the triggering factor of bedwetting. As some doctor told, constipation. Yes, constipation is one of the cause. Bladder and bowel sits very near to each other, and backed up bowel or constipation can push on the bladder. That might be the cause. That cause the child to lose bladder control. जब भी constipation की वजह से that bowels are remain full, and due to that it creates pressure on the bladder, and that might be the cause of nocturnal enuresis. Treating the constipation is often the first step to treat the bedwetting when the patient is suffering from constipation. If the child having pain or requires strain to pass the stool, that might be the cause, and that is one of the triggering factor which contribute in bedwetting. As I told you, bladder and kidney is one of the cause. This might be the cause if the child has both daytime and nighttime bladder control problem or other urinary system problem issues. Then urine frequency is there, we can think of the bladder issues or the kidney issues. Spinal injury or even any surgical thing can trigger the nocturnal enuresis. If I'm not wrong, the phrenic nerve is one of the cause. Due to that, if any issues in the phrenic nerve, that affects the bladder, and due to that, control of the bladder is loses. If the numbness, tingling sensation in lower limb along with the nocturnal enuresis, we can think of spinal cord cause, or the brain might be the cause. So the associated symptoms are required. Differentiate the cause. The other medical condition, that is diabetes in children. Even ADHD wale bacche, attention deficiency child, attention deficient hyperactive disorder child, ADHD wale bacche. In those cases, sometime enuresis might be, might be the cause of enuresis. The ADHD causes chemical changes in the brain, and that might be the cause. If child or patient is under or some medication, so we have to think about that medicine that can affect the child enuresis or urination. That even UTI, as we already discussed, UTI, recurrent UTI, especially in female child, which is very common cause of nocturnal enuresis. क्या patient को क्या explain करना है? Guys, this is the thing which is not able to explain by the parents very easily. Even in child is not expressing to the parents very easily. So that affects emotionally to the parents as well as child. It has an emotional impact in both children and their families. Children may get embarrassed feeling. What is the remedy for embarrassment?
Embragration.
Yes, the remedy is embragration. If you feel so, a patient having embarrassment feeling due to nocturnal enuresis, not every bacha having an embarrassment feeling. When you get such embarrassment feeling in some particular bacha, you can think of embragration. Feeling anxious due to enuresis, develops low self-esteem or low self-confidence. It can affect their relationship with the siblings. क्यों? क्योंकि वो बच्चे को अलग सुलाते हैं कई बार. They are not allowing child to sleep in the same bed. So that affects the relationship with other siblings. Quality of life is changed. Even school work, बच्चा रात को उठता है, उसको उठाना पड़ता है, and due to that consciousness or that concentration is reduced at the school timing. Children with bedwetting may feel like they cannot go to sleepover. Nowadays, pajama party is very common in children. Night out is very common in children. They just feel that separated from the group of people. What is the remedy? Separated feeling, forsaken feeling, abandoned feeling.
Makeup.
Yes, we can think of makeup when child is feeling such thing inside. Siblings may have to sleep in separate rooms and be woken up when the parent or bedwetting alarm wakes the affected child. Family members may have the extra work to cleaning the bed sheet and all the dirty sheets and clothes. So that is very difficult for parents also. When both the parents are working, they have to wake up 2 to 3 times at night. That is very tricky condition for them. वो 3 या 4 बार बच्चे को उठाते हैं, then they have to wake up at early morning and work for a whole day. Is quite difficult for parents. That affects emotionally to the parents. It is very important to remember that bedwetting is not child's fault. That is not under control of his or her. Family members explain the parents के किसी और के सामने never discuss such thing that creates same feeling to the child, that and never punish for such condition to the child. That is not under control of child. Instead of that, focus on working with your doctor. हमारे पास लेके आओ. We are going to treat such child. Are you getting my point, guys? Any doubt till now?
No, sir.
Now, what the precautionary thing or what are the tips you can say to the parents whose child is suffering from bedwetting? Anyone? Basic advice you give to your parent, to your child's parent?
We usually say to limit the intake of fluids 2 hours before bedtime.
Yeah.
There are also diapers available with alarm clocks. Not much of use, but theoretically पढ़ा था book में कि ऐसे alarm वाले diapers मिलते हैं. Then you can wake up the child every 2 to 3 hours depending upon the frequency at night.
One theory is that is alarm theory, but that is not practically works. Why? Causes that creates habit to the patient. Wait a minute. Hello. कहाँ थे हम? हाँ, अलार्म थेरापी. Basically, that is not work practically. Parents are putting alarm. 2 बजे उठाते हैं, 4 बजे उठाते हैं. Along with that, वो एक डायपर पहनाते हैं. So the diaper can create habit to the child. उससे अच्छा है ask the parents कि भाई एक अलार्म रखो, डायपर मत पहनाओ, हर 2 घंटे पे 3 घंटे पे बच्चे को उठाओ. That works in those kids who are not waking even after passing urine. जो बच्चे यूरिन पास करने के बाद भी नहीं उठते हैं, in those cases it works excellently. Are you getting my point? So what alarm therapy works in those bacha who are lazy or you are not waking up even after passing urine. As you told कि limit intake of food and drinks. रात को 8 बजे के बाद आप बच्चे का लिक्विड इंटेक एटलीस्ट कम कर दो, वाटर इंटेक कम करो. सी एक बार डेवलप हो गया, then बच्चा can take the water at night. There is not an issue. But now he is under the training. So in those phase, in that particular phase, बच्चा को वो इवनिंग टाइम के बाद वाटर इंटेक या लिक्विड इंटेक कम करवाओ. कैफीन का इंटेक कम करवाओ. Caffeine is one of the cause of creating enuresis in kids. Nowadays, coffee is very common in parents. तो पेरेंट्स के साथ साथ 5 साल का बच्चा भी रात को कॉफी पीता है. Due to that, caffeine can be the triggering factor in kids. Even you can advise the parents कि रात को जो नाश्ता होता है, स्नैक्स होते हैं, उसमें भी salty snacks मत करवाओ. That might be the affecting factor. Salt यूरिन का फ्रीक्वेंसी बढ़ाता है. Even sugar intake you can avoid to the child after evening. स्पेशली जब आप शुगर कंट्रोल करवाते हो तो हाइपर एक्टिव बच्चों के अंदर भी इवनिंग के बाद शुगर इंटेक कम करवाओ. जो बच्चा पेरेंट्स बोलते हैं कि रात को मेरा बच्चा सोता ही नहीं है, वो 1 या 2 बजे तक सोता नहीं है, in those cases you advise the parents to reduce the sugar intake after evening. Encourage the child. Parents को बोलो कि बच्चे को encourage करे to go to bathroom regularly during the daytime. At least every 2 hour or 3 hour. हर 2 घंटे पे या 3 घंटे पे यूरिन पास करने की एडवाइस दो या एनकरेज करो. And specially pass the urine before going to bed. Make a habit to pass the urine before going to bed. These are the very common advice. But guys, it works excellently when you give it to the parents. You can give another advice that wake your child only once during the night to urinate. कई पेरेंट्स 4 या 5 बार उठाते हैं बच्चे को. इफ इट इज रिक्वायर्ड, रात को एक ही बार उठाओ. Waking a child more than once a night may disturb his sleep or her sleep. So that might be a triggering factor, which could lead to the problem at school on next day. तो बच्चे का नेक्स्ट डे स्कूल में बिगड़ेगा. Ask the parents कि रात को एक ही टाइम 2 बजे उठाओ, 3 बजे मिडनाइट को उठाओ. और जब भी when child is in teen age, in those cases उसको पजामा पार्टी में जाना है या स्लीप ओवर में जाना है या नाइट आउट करने जाना है या ओवरनाइट कैंप्स में जाना है, nowadays it is very common. तो बच्चा सेपरेटेड फीलिंग ना करे, ask him कि go with अंडरपैंट्स, मतलब डायपर के साथ भेजो. कंसिडर योर चाइल्ड टू सेंड विथ डिस्पोजेबल डायपर. बॉक्सर के अंदर वो पहना के भेजो. एंड आस्क योर चाइल्ड, पेरेंट्स को समझाओ, आस्क योर चाइल्ड टू आस्क अबाउट द urination to the host or the parents of that particular house. या कैंप काउंसलर को बात करो, कैंप में जा रहे हो तो, एंड उनको प्राइवेट में ऑलरेडी बात करके रखो if child is going for camping if needed. Are you with me, guys? These
Yes,
are
sir.
the guys. But guys, जब भी you give this such advice to the parents, parents can feel that you know much better than other doctors. So these are the common advice. Lekin you just give to the parents. Now, the best part, which for you are very much interested, that is homeopathic therapeutic. कौन सी medicine है guys for nocturnal enuresis?
Equisetum.
Equisetum, where we have to prescribe equisetum?
When there is no obvious cause, we are finding the history, but nocturnal enuresis का कोई specific cause नहीं मिल रहा है. In those cases, we can prescribe equisetum.
Yes, perfectly saying. When there is no cause and the nocturnal enuresis, you feel that it is like a habit. It is like a habitual thing. It is just a habit to pass urine. In those cases, equisetum works excellently. Any other remedy? Equisetum is very small remedy. So this is the indication. Equisetum is very small remedy. This is the only indication. और कोई thing नहीं है.
Causticum sepia.
Yes, where to prescribe causticum?
When children pass urine as soon as they fall asleep in the first part of sleep.
Yes. When you feel that child is not able to control the urine, the sphincter is not working, especially in the first half sleep, first 2 to 3 hours after the sleep, you can give causticum 1 mHs. हर रोज रात को दीजिए, along with KP6X. Sphincter is the cause. Causticum is work on single muscle paralysis or sphincter paralysis. In those cases, you can think of causticum. Yes, Neelam? Sir, please repeat. Yes, causticum you can give 1 mHs. हर रोज रात को देना है. When you feel that sphincter is the cause, control नहीं हो रहा है due to control on the sphincter, you can prescribe causticum. Another remedy is doctor told, that is sepia. But guys, sepia is the common remedy for nocturnal enuresis that works in involuntary urination, especially when child having coughing or sneezing. Coughing or sneezing की वजह से involuntary urine हो रहा है. In those cases, sepia works excellent. Another remedy for that condition is causticum, and another is squilla, along with coughing. Even you can think of pulsatilla. Coughing or sneezing की वजह से involuntary urination हो रहा है. In those cases, sepia. In those cases, pulsatilla. In those cases, you can think of that squilla.
Even Seneca, no?
Seneca में नहीं है, that is in squilla. Seneca में sneezing है. Sneezing के अंदर we differentiate Seneca with squilla. Yes, Neelam, causticum के साथ you can give Califos 6X, KP6X. Any other remedy, guys? Most commonly prescribed remedy. बच्चे को रात को ड्रीम्स आते हैं कि he or she is passing urine in dream, and then he or she is passed urine in bed.
Creosote.
The remedy is creosote. Ask about the dreams in patient of nocturnal enuresis. That is one of the window that can lead you to the remedy. When secondary enuresis is there, in those cases, you have to find out the causative factor or psychological factor. Always make a habit to ask dreams. Sometimes you get some peculiar dreams. Dreams of snake, dreams of animal in enuresis. Which remedy?
Lacan?
Yes. I was thinking about कि आप लोग लैकेसिस ही बोलेंगे. But Lacan is the specific remedy for nocturnal enuresis. And along with that, when you get the dreams of snake, think of Lacan. Even you prescribe all the remedies and you get stuck with your case, the specific anti-miasmatic and intercurrent remedy is Medorrhinum. Yes, Sakina, give me a high five. आज आपके और मेरे प्रिस्क्रिप्शन सेम हो रहे हैं. Yes, the remedy is Medorrhinum as intercurrent, as a anti-miasmatic, whatever you think. When you stuck, when you prescribed all the remedies and you not getting result, think of Medorrhinum. Parents are very much strict. Bacha is not able to explain anything. In those cases, yes,
Carcinosin?
yes. Strict parenting, think of carcinosin. Violent parents, think of Staphysagria. बच्चे को मारते हैं, think of Staphy. These are the short, quick prescription. No need to ask mental picture of child. When you get the situational materia medica, this is called a situational materia medica, according to Sankaran sir. Any other remedy, guys, you know, for nocturnal enuresis? Creosote works excellently when there is nocturnal enuresis, especially in first sleep, along with excessive offensiveness. Acridity and offensiveness is key of creosote. Ask about the order of urine. पूछो पेरेंट्स को, यूरिन में स्मेल आती है? तो हर एक यूरिन में स्मेल तो आती है, लेकिन जो एक्सेसिव स्मेल आती होगी, तो you can see that excessiveness, offensiveness in the expression of parents. Sir, बहुत स्मेल आती है. We can't control that smell. That gesture you feel in the parents' face. बहुत स्मेल रहती है, टॉलरेट नहीं होता है, रात को बेड शीट चेंज करनी पड़ती, कंट्रोल नहीं होता है. That expression you get, क्योंकि यूरिन है, यूरिन में तो स्मेल आएगी, लेकिन that excessive smell, think of creosote.
सर benzoic acid में भी offensive urine रहती है ना?
Definitely है, और you can think of benzoic acid. Benzoic acid का यूरिन का स्मेल कैसा होता है?
Horse urine.
That is in acid nitricum and benzoic acid, both the remedy. Horsey urine. Even hurried child, even when child is going to give exam, and due to that he or she is suffering from nocturnal enuresis, think of
Chalcemium,
another remedy.
argentum nitricum,
Another remedy, Silicea. 3 living remedy. Jalcemium, argentum, Silicea. आप सब तो माहिर हो यार मटीरिया मेडिकल, कुछ सिखाने की जरूरत नहीं है. Benzoic acid, as you told, offensiveness, we can think of this remedy. Nitromur, as we discussed, psychological cause, trauma, मेंटल ट्रॉमा, चाइल्ड इज नॉट ओपन अप विद द पेरेंट्स, बच्चा स्कूल की बातें आके बोल नहीं रहा है, बच्चा गुमसुम रहता है, समथिंग इज अफेक्टिंग, बहुत सोचता रहता है, इन दोस केसेस यू कैन थिंक ऑफ नेट्रम्यूर. One rubric is there in Materia Medica, involuntary urination or nocturnal enuresis accompanied by eczema, family history of. Excellent remedy, that is sorinum.
Sorinum.
Yes. Family history में eczema है और बच्चा is suffering from enuresis, think of sorinum. Adolescence के अंदर, when child is entering in the teenage or suffering from nocturnal enuresis, two remedies are there, that is leccan and causticum. While dreaming of urination, as I told you, creosote is there, that is mentioned in boric. Lekin according to repertory, we can think of sepia and sulfur also. First sleep, as we discussed, causticum, creosote, we can think of sepia also. मेरा बच्चा रात को 4 बार यूरिन कर जा रहा है. The single remedy in repertory, that is cobaltum. Urine passes 4 times at night. The remedy is cobaltum. फुल मून के दिन ही यूरिन पास कर रहा है. The remedy is sorinum, according to repertory. डीप स्लीप की वजह से यूरिन पास हो जा रहा है. रेमेडी इज क्रियोसोट. बच्चा लीन एंड थीन है. एन्यूरेसिस इन वीकली चाइल्ड और लीन एंड थीन वीक चाइल्ड, थिंक ऑफ चाइना. Enuresis due to worm infection. According to repertory, the remedy is Cilicia, and we can think of Sina. Even TMV, Tucrium MV, worm infection in pediatric patients. Yes, moon phase के अंदर remedy is sorinum. Cystitis, when you get the report of sonography and बच्चे को cystitis है, the remedy is, guys, more specific remedy for cystitis.
Cantharis.
Yes. The single remedy given in repertory, that is Cantharis. यूरिन पास हो रहा है, लेकिन थोड़ा यूरिन की ब्लैडर में रह जाता है. पोस्ट voided urine is there. Which remedy? In any age of group.
Sabal.
No. Sabal is also there, that is for prostatitis due to prostatic enlargement. Again, this is post voided urine के लिए. Anyone? हर आधे घंटे पे, हर 15 मिनट पे यूरिन जाना पड़ता है. ओपन कोपाइवा. कोपाइवा from boric. Can anyone read Kopaiva urine?
Burning pressure, painful micturition by drops, retention with pain in bladder, anus and
Retention
rectum.
is there. There is mentioned retention with pain in bladder. Okay.
Anus and rectum,
Yes.
catarrh of bladder, dysuria, swelling of orifice,
Hmm.
constant desire to urinate,
Constant desire for urination. There is more tenesmus than cantharis. Tenesmus is present in Merksol. Tenesmus is present in Mercol. Tenesmus is present in cantharis. When you get the constant tenesmus, think of cantharis in urine. When you get the tenesmus in urine and stool, think of Mercol and Merksol. More tenesmus than cantharis is Copaiba. Constant, frequently, हर 15 मिनट पे, हर 10 मिनट पे यूरिन जानना पड़ रहा है. Think of Copaiba.
urine smells of violet, greenish turbid color, peculiar, peculiar pungent odor.
Yes. That is Copaiba. जिसकी affinity ही है bladder के ऊपर. So we can think of this remedy. The remedy
You
is
can think
Copaiba. Nilam. Copaiba.
we can think of this remedy only in cases of nocturnal enuresis or in other cases also, because we get so many.
In any age of group.
Okay.
Even you can prescribe in UTI also. यूरिन की फ्रीक्वेंसी होनी चाहिए. मुझे करूँ कॉल एक लेक्चर में. Give me 5, 10 or 15 minutes. You can think of Copaiba. यूरिन के अंदर व्हाइट डिस्चार्ज आ रहा है. कौन सी मेडिसिन? मिल्की व्हाइट यूरिन. Whatever it may be the cause. Anyone?
So salsa podila,
No.
white sedimentation in urine,
Okay.
bladder पर affinity होती है तो.
Sarsaparilla is there in more specific remedy. The remedy is petroselenium. Open petroselenium. Nowadays, sexual transmitted diseases are not very common. We are not getting such gonorrhea kind of patients. Again, when you get the male patient or female patient having milky white discharge from the urine, कई पेशेंट आएंगे कि सर मुझे धातु गिर रहा है. I don't know what is the term from English in dhatu. Again, in those cases, you can think of petroselenium. Can anyone read petroselenium?
Burning, tingling from perineum throughout the whole urethra, sudden urging to urinate, frequent voluptuous tickling in fossa navicularis, gonorrhea, sudden irresistible desire to urinate, intense biting, itching deep in the urethra with milky discharge.
सर यूरेथ्रल कैनाल के अंदर पूरा यूरिन जहां से आता है पूरी कैनाल में मुझे दर्द और जलन हो रहा है. Think of petroselenium along with cantharis. Deep in urethra and milky discharge. That is the key of petroselenium. Clematis, कहाँ पे prescribe करनी है guys? You know the prescription, you know the keynote of clematis. What is the question, Nilam? I'm not getting your question. Anupama, what is your question? Once again, can you repeat before said?
So what was the remedy?
Sorry?
The voice is not clear, so not able to listen exactly what it is. Eposinum or tetraselenium?
Eposinum मैं नहीं बोला हूँ. The remedy is petroselenium
Tetraselenium.
along with cantharis. Cantharis is all about burning and pain in urethra. तो उसके साथ साथ you can think of this remedy, that is petroselenium.
So petroselenium is one drug. I thought petroleum or selenium. something.
No. Petroselenium is the name of remedy.
Okay.
मैं कहा था
Clematis.
हाँ क्लेमेटिस का कैसे प्रिस्क्राइब करना है? We read it from Kent anytime before? No? निकालो. Yes, Sakina, stricture urethra. That is a clear
Before you
surgical case. We discussed it before, Anupama.
sir, before you spelled one remedy, opaiva something I am not getting.
Okay. Copaiva में there is frequency of urination. Along
Okay,
with
sir.
that, retention of urine is there. When you
Okay.
get in sonography, there is post-voided urine in sonography, you can think of this remedy, that is Copaiva.
Sir, can you please spell that remedy, sir?
Copiey, something kuch?
C. Okay, sir.
C.
Thank
That
you,
begins
sir.
from C. Yeah. Yes, can anyone read last para of this Kent lecture of Kent, stricture urethra from Clematis? मेरी कैंट मिल नहीं रही है. जब भी आपके पास पेशेंट आता है स्पेशली इन यंग एज और आपको बोलता है कि यूरिन अटक क्या आ रहा है, सी द अटक क्या आ रहा है इज वेरी कॉमन इन ओल्ड एज ड्यू टू एनलार्ज प्रोस्टेट. लेकिन व्हेन यंग एज पेशेंट केम टू यू और यूरिन अटक क्या आ रहा है, तो अलोंग विथ यूटीआई यू हैव टू थिंक अबाउट स्ट्रिक्चर यूरेथ्रा.
सर रीड करना है.
हाँ क्लेमेटिस मिली आपको?
यस सर.
पढ़ो. किसके बाद है? कोक्यूलस के बाद है? कोकस कैक्टाई के बाद? Yes, I got it. चलो. It is the nature of this remedy to infiltrate and inflame tissues, and hence it is useful in those cases of gonorrhea where they have been slow in passing away, where they have been treated by injection. The slow inflammation of the urethra will infiltrate and urethra feels like a large whipcord, painful upon pressure, and this goes on until the canal is almost closed. You will be surprised to find when clematis is indicated that after giving that remedy, the discharge is re-established. And soon the old stricture goes away. At the end of 2 to 3 months, he feels nothing of it. क्या पता चला? Guys, what did you understand from this para? When you get the patient of stricture urethra and you prescribe this remedy for 2 to 3 months, that can be completely cured. Stricture urethra is a completely surgical condition. And dribbling of urine is a key feature of stricture urethra. Patient cannot quit empty the bladder. He always feels as if there was a little more, and when he appears to have finished it, will keep dribbling away. This is the common feature of stricture urethra. inability to evacuate all the urine at once. When beginning to urine, it burns the worst. शुरुआत में जलन excessive होती है. While urinating, it sticks in urethra, and after urinating, it still continue to burn. मतलब पहले भी होता है, during भी होता है, बाद में भी होता है. Another remedy is taffy. Throughout the urination, before, during, after. Last drop burns, that is apis. This is the clematis. जरा ऑफ द ट्रैक हो जाता है जब भी मेडिसिन की बात होती है. लेकिन दिस इज द सर्जिकल कंडीशन in which you can think of clematis. Even in dribbling of urine, you can think of clematis in nocturnal enuresis as well as in involuntary urination, or even in UTI. Are you with me, guys? Any query for nocturnal enuresis? Any question for nocturnal enuresis? Okay, so nocturnal enuresis is almost cover all the remedies. These are the common remedies. It gives result. Psychological cause, we have to find out and work on it. That works excellently.
Doctor, can you share one or two cases wherein you have treated nocturnal enuresis?
मुझे केस याद नहीं रहते. The main thing is I'm never able to share my whole case. क्योंकि मैं पूरे केस में मुझे 2 ही सिम्टम पता होता है जिसके ऊपर से मैंने प्रिस्क्राइब किया होता है. So these are the things I'm sharing with you. वो पूरा 1 घंटे का केस लेके नेट्रोम्यूर ही देना है तो I don't like such kind of case sharing. पूरे सेमिनार में लोग एक पूरा केस बताते हैं, अल्टीमेटली ब्रूडिंग होता है और नेट्रोम्यूर प्रिस्क्राइब किया होता है. That is a time wasting. उसके जगह पे we have to learn the different remedies. तो केसेस मुझे शेयर करना is time wasting thing. क्योंकि ultimately I am prescribing on 2 or 3 symptoms only. So 2 or 3 symptoms I am sharing with you. So case discuss करना is not a deal, not a much deal. Question from Sultana: what are the conditions under which enuresis is irreversible? जिसमें हमने 3 या 4 महीने होम्योपैथी दवाई दे दी और child is not curable, that is mostly irreversible. Believe me, guys. आपने होम्योपैथी प्रिस्क्राइब कर दी है on the specific condition, or although you are not getting the result, believe me, no other pathy can cure such case. वो नहीं होगा. There is no remedy in allopathy science for nocturnal enuresis. Not a single remedy. आप कोई पीडियाट्रिक में काम करता है? It is according to my knowledge. अभी तक तो मुझे कोई प्रिस्क्रिप्शन में नॉक्टुरल एनुरेसिस की मेडिसिन नहीं मिली है. If you are dealing with some pediatrician, ask them about the remedy. They don't have any medicine. If the central nervous is the issue, if the spinal cord is the issue, in those cases we can think of zincum med. If the nerve is cut off, we can't do anything. That is the irreversible thing. Again, in pediatric cases, that is not the cause. If the milestone is normal, if childbirth is normal, कुछ cause नहीं होते. Congenital defect is there, then we can't do anything. These are the limitations. इसमें we can't help anything. Bladder छोटी सी है, irritable bladder है. Those are the things. Psychological cause की वजह से irritable bladder है, तो we can help. लेकिन already short bladder है, in those cases we can't help. Any question, guys? Any query?
How will we diagnose those cases, like any diagnostic test?
Basically, we can go for sonography in initial stage if patient is not responding with medication. If sonography is not revealing anything, we can go for CT scan or MRI. So congenital defect hogi, that we can rule out in MRI.
Okay.
और बहुत सारे रिपोर्ट्स भी होते हैं, यूरिन फ्लो का भी रिपोर्ट होता है, तो दैट विल हेल्प कि ब्लेडर के मसल्स इज नॉट हेल्पिंग, नॉट वर्किंग प्रॉपरली और नॉट. इफ ब्लेडर इज नॉट वर्किंग प्रॉपरली, ब्लेडर के मसल्स आर नॉट प्रॉपरली वर्किंग, तो पेशेंट को फ्लो नहीं होगा. पेशेंट आपको बोलेगा कि मुझे यूरिन का धार नहीं हो रहा है. यूरिन इज नॉट गोइंग टू फार अवे, वो डायरेक्ट वर्टिकली नीचे आ रहा है. सो द कॉज माइट बी द ब्लेडर मसल. वर्टिकल यूरिन कौन सी मेडिसिन है guys? Patient is passing urine vertically. The remedy is, anyone? Nikalo है parcel. Have you ever read that thing in Heparsal? Voided slowly without force drops vertically. That is written in Heparsal. Bladder weak. Bladder is weak. Due to that, patient is not getting force. पढ़ते रहो. Heparsal not is all about respiratory. कुछ और मिलेगा. When you read medicine constantly, कुछ नया नया मिलता रहेगा. Bladder difficulties in old men. The remedy is phosphorus, sulfur, copaiba, and Heparsal. It is mentioned in boric. Any question, guys?
सर डिलेड माइलस्टोन विथ नॉक्टुरल एन्यूरेसिस तो क्या रहेगा मेडिसिन?
Barata cup, calcarea cup, we can think of it. Even stramonium, we can think of it along with fear. Even lean and thin constitution, black skin, we can think of calcarea phos in delayed milestone. Even causticum, that is also delayed milestone to control on pincher. When we get the constitution like calcarea, where we get the constitution like Barata, it always works.
Sir, fear of going in dark?
Stramonium, these specific remedy, these specific. Alzheimer's is also there, lekin these specific remedy is stramonium. According to Sagal method, they are randomly prescribed stramonium for fear of darkness. And it works. Any question, any query, guys? I hope आपको ये सब मेडिसिन से क्लिनिक में रिजल्ट मिलेंगे. एंड डू वर्क रिजल्ट ओरिएंटेड. वो कान में ओपियम बोलना वगैरह मत करना कभी. पेपर के ऊपर इग्नेशिया लिख के मत दो कभी. डू द साइंटिफिकल वर्क. अभी भी मैंने एक एक्सपीरियंस सुना, दैट इज ऑल्सो लाइक दैट इन सूरत. तो सूरत में बहुत बवाल चल रहा है, बहुत बवंडर चल रहा है. इट इज अ सिटी ऑफ गुजरात. आई डोंट नो ये लोगों को कहाँ लेके जाएंगे, लेकिन साइंटिफिकल प्रैक्टिस करो गाइस, एंड दैट हेल्प्स. ओके गाइस, see you in next session with same dhamal, with same energy, with some another new remedies.
हाँ, मैंने लेक्चर की शुरुआत में वो क्वेश्चन एक लिखा हुआ है मैसेज में. कैन वी प्रिस्क्राइब नेट्रम्यूर इन केस ऑफ हाइपरटेंशन? मतलब सोल्ट को पोटेंटाइज फॉर्म में, मतलब आई जस्ट थिंक क्या.
क्वेश्चन तो अच्छा है, लेकिन यू कैन थिंक ऑफ नेट्रम्यूर बायोकेमिक फॉर्म. नेट्रम्यूर what nahi, then you can't prescribe netramure in biochemic form. That is contraindication of netramure in biochemic form. नेट्रम्यूर रिटेंशन करता है यूरिन का, तो रिटेंशन की वजह से हाइपरटेंशन हो सकता है. इट नेवर वर्क्स एज अ डायूरेटिक. सो नेट्रम्यूर इफ वी गेट एज अ कॉन्स्टिट्यूशनल रेमेडी वी कैन गिव इट, लेकिन आप जो बोल रहे हो वैसे नहीं दे सकते.
Okay. Thank
Okay.
you, sir.
Any question? Okay, guys, see you in next session. Till then, enjoy with homeopathy.